Recovery housing admissions has one trap. If you can't say which bed opens next and who is ready now, you don't have a wait list. You have a queue of risk. Recovery housing operators lose occupancy not only when demand is weak, but when bed turnover, admissions timing, and waitlist follow-up are handled informally. Bed management and waitlist operations, from new inquiry through pending discharge. Here is the admissions to discharge workflow for recovery housing operators. We cover the shared bed statuses, the referral pipeline, and the active waitlist workflow that keeps occupancy steady and referrals moving. The admissions to discharge workflow is the operating system that answers at any moment which bed opens next, who is ready now, and who needs a call back today. A shared set of statuses is what prevents 3 staff members from giving 3 different answers to the same referral source. It ties together bed turnover, admissions timing, and waitlist follow-up, so none of them depend on memory or an inbox. When bed management and waitlist operations are loose, occupancy drifts, referral sources lose trust, and staff burn time calling people back. Bed operations affect more than occupancy. They affect referral source trust, resident placement speed, and financial predictability. Informal follow-up means staff time gets spent calling people back, and transfer coordination across levels of care slips. Behave Health is designed to make open capacity visibility usable, so the workflow runs on shared statuses instead of guesswork. The bed availability widget is designed to show open capacity in a way the whole team can actually act on, not bury it in a spreadsheet. The recovery residence software is designed to support the broader admissions workflow, so bed and referral statuses live in one place. Every residence should define a simple, shared set of bed statuses. These 6 carry a bed from admission through discharge and turnover. Defining them once is what keeps occupancy clear instead of drifting. Let us walk through all 6. Statuses 1 and 2, available and reserved. Available means the bed is open and ready for a new resident now. Reserved means the bed is held for an incoming admission, so the team does not double book it. Status 3, occupied. Occupied means a resident is currently placed in the bed, the core of your active census. Tracking it cleanly is what gives you reliable occupancy numbers instead of estimates. Status 4, pending discharge. Pending discharge flags that a bed will open soon, so the team can line up the next admission instead of reacting late. Seeing turnover before it happens is what lets you answer which bed opens next. Statuses 5 and 6, turnover and temporarily unavailable. Turnover or cleaning marks a bed that is between residents and not yet ready to fill. Temporarily unavailable keeps a bed out of rotation, so it is never offered to a referral by mistake. On the referral side, most teams need a parallel set of statuses that move a prospect from first contact toward admission. Every referral starts as a new inquiry, then moves to screening in progress as the team works it. Ready now means the person can be placed. Waiting for documentation means a specific item is still outstanding. Waitlisted holds qualified prospects, and not a fit closes the loop cleanly, so the pipeline stays honest. The strongest teams treat the waitlist like an active admissions workflow. Every person on it carries the fields that drive the next action. Each person should carry a referral date, target program or house, and readiness notes, so prioritization is not a guess. A required follow-up item, a next contact date, and an outcome if they decline or become ineligible keep the list moving. Bed management and waitlist operations are not administrative side tasks. They are core operating systems for recovery housing. When the statuses are clear, referrals move faster, and the house runs with less chaos. Clear bed operations support referral source trust, resident placement speed, and financial predictability. They also support transfer coordination across levels of care, so residents move without falling through the cracks. Stop losing occupancy to an informal admissions workflow. Book a 20-minute demo of bed and waitlist management at behavehealth.com. See shared bed statuses, the referral pipeline, and an active waitlist built for recovery housing at behavehealth.com.